A study of advanced medical imaging among 6 large healthcare systems shows how frequently these tests are used and the amount of radiation patients receive.
Of all imaging tests that are done, the most common involve x-rays, a chest x-ray, an x-ray of a broken limb, just a plain film radiograph. Advanced imaging tests, CT, MRI, PET, ultrasound, nuclear medicine, account for about 35% of all imaging tests, as opposed to 65%. At the beginning of the study, CT scanning went from about 50 scans per 1,000 enrollees to about 150 scans. MRI went from just under 20 scans per 1,000 enrollees to 65 scans. CT scanning, even though it's only around 10% of studies, accounts for 70% of the radiation exposure.
The study also shows variations among centers and patient groups.
One plan, maybe they will have gotten 7 angiographic studies in 1,000 patients. That's the kind of study you do to look at the heart. In another place, they would have done 78 studies, so 10 times higher. There's a smaller group of patients who's really getting the bulk of the testing and the exposure. So that's why over 10% of patients who have any imaging receive high or very high radiation exposures. There's this belief that we've solved the problem about radiation dose because there's been increasing awareness of it the last couple of years, and I'm not convinced at all that we've solved the problem. The doses that we found, particularly in children and young adults, were much higher than I thought they were going to be. We really want to lead to the more prudent use of medical imaging and the more appropriate dosing of those studies, which currently we don't have.